I'm Tanner.
I'm Alden.
I'm Stephanie.
I'm Holliann.
And I'm Megan.
Our evidence-based practice project is going to cover the challenges with coronary artery disease. Coronary artery disease, better known as CAD, is a health issue that will affect most Americans in their lifetime. The coronary arteries supply oxygen to the heart tissue. CAD is caused by a buildup of plaque and cholesterol in the coronary arteries, making them eventually become hardened and stenosed or narrowed. This in turn causes turbulent flow through the coronary arteries, which leads to a decrease in oxygen reaching the cells of the heart. This will cause a decreased cardiac output and lead to problems such as fatigue, activity intolerance, syncope, risk for cardiomyopathy, risk for systemic ischemia, risk for stroke, risk for hypertension, risk for MI, and risk for sudden cardiac death. With this being said, there is obviously great concern from the healthcare teams because the disease process could trickle down from heart to vessels to organs such as renal failure as results of hypertension. You know, with America's eating habits being mostly takeout from the local grease traps, the prevalence is extremely high in America. Other predisposing disease processes include diabetes, especially uncontrolled, and obesity. Our goal is to point out areas that concern the healthcare world and ways in which to better avoid and treat factors associated with coronary artery disease.
I'm going to describe the challenges of coronary artery disease to nurses. One of the causes of coronary artery disease is smoking tobacco. Nicotine causes vasoconstriction and is one of the causes of plaque formation. According to an international nursing review, smoking cessation success rates are really low, even after patients who have experienced lethal MIs. Studies show that patients who stop smoking will regain normal lung function in 6 months, which can improve the oxygenation to the heart tenfold. Obviously, smoking cessation is a huge challenge to nurses because no one can force someone to quit an addiction. Just like you can lead a horse to water, but you can't make them drink. You can give all the information in nicotine patches or gum to patients, but that will not be successful until the patient is ready to quit and ready to make a lifetime commitment to quitting. Coronary artery disease is a challenge to nurses because a patient can experience acute coronary syndrome on your watch. Nurses need to know how to act fast and treat anyone experiencing signs or symptoms of an MI. I like to remember the mnemonic MONA, M-O-N-A, which stands for morphine, oxygen, nitroglycerin, and aspirin. Hopefully, the admitting physician who diagnosed the patient with coronary artery disease already has orders for PRN, morphine, nitroglycerin, and aspirin, but if a patient is having chest pain that does not go away with rest and is radiating to the left side, the nurse's first response should be administer oxygen and then call the doctor to get orders for other vasodilating agents, such as morphine or nitro, and also blood thinners such as aspirin. Check for any ECG changes such as elevated ST segments, and make sure the charge nurse is aware of a possible code blue and have a crash cart ready for use. Every day, a patient complains about their hospital food. Not many people like eating non-salted food or bland food. Cardiac diets are given to patients who are diagnosed with coronary artery disease. Most patients will suck it up and eat the food they are given, but it becomes a challenge to nurses when the patient refuses to eat the crappy hospital food. Patients who are diagnosed with coronary artery disease are probably used to eating high-fat, high-cholesterol foods. Start educating the patient while he or she is in the hospital about changing the diet to a low-fat or low-cholesterol diet. Have a registered dietitian give a list of foods that are good to eat. And once again, you can't force someone to eat healthier, but educating the patient early on will be more effective than discharging the patient with no resources. Also, during your shift, make sure the patient is eating enough calories. If not, notify the healthcare provider and find out other alternatives.
Okay, so basically the main barrier to coronary artery disease is drugs don't work for people who don't take them. Many barriers are correlated with coronary artery disease, and we're going to specifically talk about 3. CAD is a serious medical condition. When diagnosed, it requires immediate medication prescription, and it's going to be continued for a lifetime. Medication compliance is the #1 barrier for this healthcare issue. Often patients take their medications, their blood pressure will lower, their signs and symptoms will subside, and they feel like they don't need their medications anymore. This leads to a relapse of problems and complications. Another reason for medication noncompliance is the expense of medications. Unfortunately, over time, their medications will accumulate, and they'll be put on multiple medications to control and manage coronary artery disease. This can become expensive. They're not aware that many of these places, such as Walmart and Walgreens, offer medications for cheap and automatic refills. So they don't even have to call in their prescription every time they run out. Another barrier to coronary artery disease is lifestyle and the way that we Americans live and are accustomed to. 99-cent hamburgers are cheaper than salads. McDonald's is cheaper and a lot faster than going to the grocery store and buying fruits and vegetables. The stress that dictates many lives lead people to participate in behaviors like smoking. Smoking causes vasoconstriction of the blood vessels, which increases the complications of coronary artery disease. It's extremely difficult for people to quit smoking with the added stress of being diagnosed with coronary artery disease. The last barrier for CAD is deficient knowledge. Many patients lack the knowledge of CAD and how to avoid it, treat it, and manage its symptoms. As nurses, it's our responsibility to educate our patients verbally and providing them with resources to refer to if they have any question regarding their diagnosis. We should give them no excuse for not complying with their treatment.
Okay, I'm going to talk about the methods of overcoming the challenges that Megan's already described. Avoiding cigarette smoking is the major treatment option for preventing the atherosclerosis that comes with CAD. The longer you smoke, the harder it is to stop smoking. Nicotine patches are often given in the hospital to help patients resist from smoking. Other patients feel that the cold turkey method is the hardest thing to do. However, there are others who feel it's the easiest option. Other methods that nurses need to be knowledgeable about to teach patients to avoid smoking is keeping gum or mints with them, or if they feel the urge to smoke, they can grab a bag of chips or grab something to eat just to use like the hand-mouth stimulation. Other new advances have helped with smoking cessation, like the e-cigarette and the vape, and other people say hookah can help them stop smoking. Nurses working on cardiac units should have options of continuing education classes that they can go through to help with skills if an MI occurs. Classes for knowledge of cardiac rhythms is necessary for the nurse to be able to read the heart monitor and respond effectively. Taking extra pharmacology classes can help the nurse know about all the side effects certain drugs have on your heart and the drugs that are needed during acute MI. Education on the use of nitroglycerin can help patients and the nurse manage their symptoms. Patients should know that if taking nitroglycerin at home, they should take one, and if it doesn't work, take another one 5 minutes later. If that doesn't work, they can take one more 5 minutes later for a max of 3, and if that doesn't work, they should call 911. They do not need to keep them in the bathroom and should keep them in a dark cabinet. And also, while taking nitroglycerin, patients and nurses should know that they should sit up first and then rise slowly to avoid hypotension and to decrease the fall risk. Another method to overcome challenges that coronary artery disease has is that helping the patients know what diet choices to choose from to help with the disease. Patients should know how to choose fruits and vegetables, whole grains, low-fat dairy products, fish and nuts, and they should limit the red meat and sugary foods and colas. When preparing food, the patient should know that you should use lean meats without skin, and they should not add saturated fats or salt. Intake of sodium should be less than 1,500 milligrams a day. Eating fish at least twice a week is a recommendation. Also, patients who drink alcohol should drink in moderation. 1 drink per day for a woman and 2 drinks for a man is the recommendation.
There are many opportunities for professional nurse involvement with coronary artery disease. The nurse will be able to help with educating patients at risk how to maintain a healthy lifestyle and reduce some of the risk factors for coronary artery disease. This could be done by educating the patient on the importance of adherence to medication regimens, smoking cessation, weight control, regular exercise, a healthy diet, and controlling pre-existing conditions such as hypertension and diabetes mellitus. The nurse can help promote self-efficacy, which, according to Kang and Yang in the article Cardiac Self-Efficacy and Its Predictors in Patients with Coronary Artery Disease, refers to an individual's internal resources, including a positive attitude and confidence in the capacity to manage his or her condition. The article also states that the person with higher self-efficacy is more likely to perceive a disease as controllable and manageable. So by promoting this, it could possibly help the patient better manage the disease. The nurse should help promote awareness of the disease. Lack of disease knowledge is a barrier to modifying risk factors and changing the patient's lifestyle. If the patient has a higher understanding of the disease process, he or she will be able to better understand the importance of preventing risk factors and following healthcare professional orders after being diagnosed with the disease.
Bloopers.
Nursing field.
First of all, you can't say
And I was like,
Our evidence-based.
Good Lord.
it's going to take all day. We're done.